last week we discussed about myths surrounding oral health and pregnancy, didn't we, Graham?
Yeah, we did, Jasmine. Things like gain a child, lose a tooth, or calcium leaking out of your teeth, things that aren't true.
But there are actually real risks involved with pregnancy and oral health, and today we're going to discuss some of them.
Of course we are. Jasmine, the main ones, things like cravings for sweet things, which can lead to tooth decay, changes in hormones, which can affect your gums, morning sickness, which is introducing more acid into your mouth and potentially damaging your enamel, and generally avoiding going to the dentist as well.
So you brought up quite a few issues, and you mentioned food cravings. Can you tell me what the problem there is with regards to that?
Yeah, of course. Well, it could be crazy cravings that I've heard of, some of them, but the ones I'm mostly worried about are cravings for sweet things. If you've had generally a good healthy diet and you don't suffer from tooth decay, it's possible that during your pregnancy, if you are binging on a lot of sweet things during that time, that may raise your risk of tooth decay.
Of course.
What we can try and do is to obviously limit the number of sweet snacks that you have, but also you can try to rinse your mouth out with some water to help rinse the sugar out of your teeth, and obviously brushing and flossing and doing all the regular things that you do well, and obviously having them your teeth checked at the dentist regularly too.
Now, what about gum health? You mentioned hormones can affect your gum health. Can you tell me more about that?
Yeah, well, correct. Hormones can affect your gums and they can make them more red, tender, inflamed.
Right.
It's even enough to put some pregnant women off cleaning their teeth properly. What you've got to remember though is that the gums, they're reacting to the germs in your mouth, to the plaque that's being formed. So if you aren't cleaning your teeth properly, that will actually make the gums worse. You'll end up with gingivitis or potentially gum disease. Try to make sure that you are cleaning your teeth regularly and thoroughly, toothbrush and floss, but also having your regular preventative cleaning at the dentist, that'll help too.
So what about morning sickness? How does that affect someone's oral health?
Well, morning sickness is bringing stomach acids up into your mouth. Stomach acid is very low pH, and it can do damage to your enamel by stripping away layers of your enamel. Some people can make it worse by having that impulse to brush their teeth straight away. In fact, you can strip away more layers of your enamel by doing that. What we recommend that you do is, after a bout of morning sickness, is rinse your mouth thoroughly with water, then waiting at least 30 minutes up to an hour before you actually go to brush your teeth.
Now, what about pregnancy and dental treatment? Can pregnant women get dental treatment?
Yes, of course they can, Jasmine. This is a myth that keeps persisting about how pregnant women can't have dentistry performed, and it's just not true, and it's quite an upsetting myth. Routine and emergency dental treatment should be performed on pregnant women, especially when an infection is involved. Infection can affect the development of your baby, so you need to get that taken care of as soon as possible. X-rays and anesthetics are completely safe to use during pregnancy. Your dentist should be up to date with the information that helps them to make sure that treatment is safe during your pregnancy.
So that was a lot of information and really helpful. And to summarize everything, basically try not to eat too many sugary foods.
Keep your gums and your teeth clean.
Don't brush immediately after a bout of morning sickness.
And continue visiting your dentist for your regular preventative services. And if you have any infections, get them treated straight away.
As always, if there's any questions, please feel free to ask us and leave it in the comment section down below. And if you found this video very helpful, follow us on Facebook and Instagram.
Thanks for watching.
Bye!